Researchers pulled 270 trials on exercise and blood pressure, and they looked at nearly 16,000 people to answer one question: which type of exercise lowers blood pressure the most? And it wasn't running, and it wasn't lifting weights, and it wasn't doing intervals. It was holding still. And specifically, they looked at a wall sit. And the beauty was this exercise only took a few minutes. And on average, it lowered the top number, the systolic pressure, by about 8 points, and the bottom number, the diastolic pressure, by about 4. But there's an important nuance to this. That ranking is based on probability and not a clean head-to-head win. And combined training, so cardio plus weights, was still close behind. And for the bottom number, which is your diastolic pressure, running actually came out on top. So the takeaway here isn't to replace cardio, it's that isometric exercises like a wall sit are just another effective tool for lowering blood pressure, and it's a tool that doesn't take much time. So why would staying still do anything? Well, for years, that explanation centered on nitric oxide, that molecule that helps your arteries relax. You hold the muscles tight and squeeze the blood vessels inside it, and then let go, and that rush of blood signals your artery to open. And that's probably part of it, but the stronger evidence points to your nervous system. Holding that tension seems to reset the automatic controls that help regulate your blood pressure. Your body doesn't clamp down your blood vessels as much, and there's less resistance for your heart to pump against, which makes your overall blood pressure to go down. And the protocol is pretty simple, but intensity matters more than how low you go. Start with a shallow bend that you can hold for the full 2 minutes, and then gradually work your way down over weeks to months. And eventually we want to stop at about a right angle of the knee. That's about as deep as a lot of these studies went. And then as you're doing this, by the last 30 seconds, it should feel hard, but this is important, we don't want to be holding our breath. And that's 2 minutes on, and then you rest and you do 4 rounds. And you do that 3 times a week. Now, aerobic and interval training still have the strongest evidence, especially for lowering blood pressure over a full 24 hours, which predicts long-term risk much better than a single office reading. So I look at this more as an add-on and not a replacement for your cardio. And one last thing, during the hold itself, your blood pressure actually spikes for a short time. So before trying this, talk to your doctor to make sure this exercise is safe for you. And that's especially important if you have uncontrolled high blood pressure, or heart disease, or certain eye conditions, or joint problems, or any other medical condition that could make this type of exercise unsafe. And those are just a few examples of the conditions where you need to be careful, and not a complete list. But that said, in studies of older adults training at moderate effort, researchers haven't reported any safety problems. For most people though, this is about as simple as exercise gets. You don't need a gym, no equipment, just 4 2-minute wall sits 3 days a week, and you can do that almost anywhere.